Hello, I'm Solomay Tibabu, the founder and host of the Going Digital Behavioral Health Tech Conference. I am so excited to have Gaurang Choksi, founder and CEO of Violet, here with us. Thank you so much for joining me.
Yeah. Hi, everyone. Great to be here.
So let's get started with tell us a bit about your background and what is Violet?
Yeah. I'm Gaurang. I'm the founder of Violet. Prior to building Violet, I spent a few years working at Oscar Health, which is a health insurance company built from the ground up. And one of the biggest pain points we really had building an insurance company was how do we help our patients actually get to the right doctor? And at Oscar, we had a disproportionately large amount of LGBT members. And as somebody who's a part of the LGBT community, there's a lot of compassion and empathy for helping my community get to the right place. And so at Violet, we're building a data product, a platform that'll act as a de facto credit agency for cultural competencies. So in simple words, we're really doing our best to use data to help people find the right doctor for them.
Can you tell us a little bit more about what the problem is around cultural competency and how the industry is struggling with it?
Yeah, I'll actually start with a personal example. Even last year, I went to a primary care doctor here in New York City, and the doctor was employed by one of these fancy startups, and the physician I was paired with didn't know what PrEP was when I asked for a refill. And as a gay man who's been on PrEP for 4 years, it was quite a jarring experience to end up with a physician that couldn't prescribe me a medication or didn't know about a medication that the CDC really recommends that any sexually active gay man take consumes. And to me, that's a prime example of what cultural incompetence looks like, which is not that she was a poor physician. In fact, she's a spectacular physician. It's just she wasn't a great physician for gay men. And to me, it's unrealistic to look at every single doctor and to expect them to know every single community in really strong detail. And so for us, we really think cultural competence is when a physician, either really any specialty of physician, is able to understand a patient and see the full all of the identities of that patient, know what health disparities disproportionately affect that patient and their communities, and be able to be the advocate for them. And by building the right kind of a relationship and trust, that patient should be able to ask all the questions they have, such that they don't need to go home and feel that they can trust Google more than the provider that they're paying a lot of money to go see.
Thank you so much for sharing that story. It's super eye-opening, and I'm sure these kinds of situations are happening literally every moment, every day in doctors' offices across the country. Could you share a little bit more about the flip side of what does it really mean to have culturally competent care?
Yeah, a great question. And my team and I have been spending lots of time, A, looking at pre-existing research, but B, working with some really industry-leading hospitals and their quality teams to define what cultural competence means. What we really look at as a technical platform ourselves is four key pillars of information. For us, we really care about one, who is the provider themselves? Are they a person of color? Are they LGBT? What communities do they and their immediate family belong to? Two, we care about where they've worked and what patients they've worked with. We think hands-on experience is really vital to really understand a community. And so we look at longitudinal data around, have you worked at a center for transgender healthcare? Or have you worked at a community center? Because we know that'll give you a lot of exposure to a specific community. Three, we look at their training history, which frankly is such a treasure trove of data. Clinicians have so many options in choosing what trainings they consume. And what we care about is, where do your interests reside? If you're a culturally competent provider that's really focused on a specific community, we see data that shows that you've consumed trainings about how to best work with specific communities or what disparities affect specific communities. And then finally, what we really care about is giving the physician a voice, which we think a lot of tech companies really miss, where they almost dehumanize the physician. And what we care about is really understanding what communities do they want to work more with. What we saw a lot from our physicians is they got into medicine to really help the world. And by hearing them out and understanding what communities they want to best work with, we actually are able to help them do exactly the reason that they got into medicine for. And so for us, cultural competence really is a mix of all of those variables about a provider, really understanding who they are, where they've worked, who they've worked with, and what they've learned, and also who they want to work with. And all of that goes into our platform to really understand and denote the cultural competencies they have.
if there's any trend that has really continued to grow, I think that it's providers who want to serve underserved populations or groups from or populations that reflect their own background. And so that's really exciting to hear how you're empowering them. Can you tell us a little bit more about the enterprises that you're partnering with to enable the platform?
Yeah, I'm really excited to share that even though we're a startup that's only been around 9 months, we have a paid pilot with one of the largest hospital systems here in New York. We haven't announced the partnership yet, but they're also potentially joining us as an investor. But what we're really excited about is given the size of this hospital system, 1 out of 3 of their patients is on Medicaid. They're really a thought leader in how to best serve many different underserved communities. And for us, they're excited to work with us to personalize healthcare. Something that they really highlighted that we really had a lot of conversations around was healthcare is becoming personalized, but it's not actually being personalized for the 1 out of 2 Americans on a public program, such as Medicaid, Medicare, CHIP, or even ACA plans where at Oscar, where I used to work. Right now, a lot of the verticalized brands we see that either serve direct to consumer or they sell through a commercial insurance plan that an employer is usually self-insured with, but those plans don't reach really the 1 out of 2 Americans that are relying on a public program. And so for us, what we're passionate about is let's use data to personalize healthcare and improve healthcare such that everybody can access a culturally competent doctor, not just people who are able to afford D2C products or B, people employed by corporate America.
This idea that Violet is leading with data, I think that's something that makes you guys unique. Certainly, there have been other startups sprouting out that are focused on culturally competent physical health or culturally competent mental health. Can you give our audience a little more background of how Violet is different?
Yeah, we see a lot of startups building public directories or custom direct to consumer products where usually they'll stratify by 1 of 2 axes. A lot of times we'll see brands like Folks, Tia, Maven that are really targeting a specific patient population or a community. And then the other axes will be brands that are stratifying healthcare by clinical needs, such as Equip for eating disorders or Tempest for substance use. While we love what all of those brands are doing, thematically, what they're really doing is using human capital. They hire their own providers and then deliver care to the communities that they really serve. What we believed in was healthcare is broken not just in the front end with the branding, it's broken in the back end. Where even as an insurance company, when we were trying to help our patients and members at Oscar get to the right doctor, we didn't have a clear data set around which doctors were the best ones for the members that we represented. And so for Violet, outside of being a data platform, we're a business to business healthcare infrastructure product. So we're not fighting for the attention of customers and we're not spending boatloads of money on advertisement. For us, we're spending our time and energy on really figuring out what are the right questions to ask to understand what cultural competencies a doctor possesses. And there's a lot that we're still learning. Maybe the answers, the questions we ask will change based on the specialty of the physician. But these are all things that we're really excited to really sort out through this paid pilot that we're doing over the next 6 months with this large hospital system here in New York.
Yeah, that's really great. And let's say I'm a provider and I could use some work in any one area that is identified from the Violet platform. What's next?
Yeah, great question. Our intent is we don't think cultural competence happens just because you did a bunch of online trainings. We fundamentally believe that cultural competence happens after a lifetime of learning. And that learning comes from either self experiences you've personally faced through lived experience, experiences you've seen through the patients and the communities you've served, or experiences you've had and through the education you've consumed. So for us, by having this multifaceted view, we really want to help the provider grow through the many facets that we evaluate. So our long-term goal is immediately we are connecting the physicians to curated third-party education that teaches them about cultural competence, about best practices for working with specific communities, or even disproportionate disparities that affect communities. But the longer term goal is to work with their employers, the hospital systems, and the provider organizations. And enable them to have the hands-on experience that they needed to complement the learnings they're receiving. So for us, it truly is, let's understand what makes somebody culturally competent, and then let's help them grow through the many facets that we evaluated.
For our audience, we've got payers, providers, employers, investors, startups. How could our audience support your work or get involved somehow?
Yeah. Our ask would be to work with us. We are a startup that's very realistic, and we understand that we're not the experts in a lot of this. What we really are looking for are thought leaders to partner with. So whether it's working with us on helping us define what cultural competence looks like, or working with us on piloting our product within your payer organization or your provider organization, we're excited to share more about what we're learning and what we've done in the past with other systems and what we can do for you. For us, fixing healthcare requires participation and really thought leadership from many different actors in the healthcare system, and we would love to get to know you. So if you're interested in learning more, please go to our website and request a demo on the site.
Great. And now I'll ask you, Gaurang, what do you think is, or what do you think, what's your hope for the future of behavioral health and really culturally competent healthcare in general?
I get so excited by this question. We really want to personalize healthcare. That experience that I shared around ending up with a doctor that didn't know what prep was, we're hoping to make those types of experiences a thing of the past. And the way to do that is to help all of the current provider organizations deliver personalized healthcare. And so the way we really are approaching this is, right now we're building badges that help the industry understand which doctors are culturally competent, and we're focused on specific communities. But the goal is to not just create personalization based on communities, but maybe in the future we create badges for which doctors are spectacular at specific clinical needs, or even badges based on specific life events. We spoke to a specific patient who told us that after she had an abortion, she felt judged by a specific other provider. And so for her, that life event was an instance where she actually wanted cultural competency centered around the life event itself. And so we're excited to help personalize healthcare for all kinds of individuals. And we know that as humans, we have many identities, and it's important to find a provider that can speak to the intersectionality of our identities. And so for us, the way we're building our product, we're really excited about enabling the end user or the patient to find the right clinicians for them based on all of the identities and experiences they possess too. So hopefully we'll build a world where it's not, I go to this brand because I'm a part of the LGBT community and this brand because I'm a POC. It's really, I'm a human, here is the many identities I possess, find me a doctor at this specific hospital system that meets my needs.
So you've had great experiences at companies like Oscar Health. What is it that prompted you to start a startup?
Great question. I'm an immigrant. I grew up on Medicaid, and I'm a gay man. So for me, each day when I wake up, I'm pretty cheerful, but there is this natural inkling to change the world. And I really do see being in America as such a blessing quite often. And for me, having the opportunities that I've been presented with, I almost feel foolish if I didn't actually take them. So each day, especially as I was kind of navigating my career at Oscar, I felt a lot of passion in seeing so many other talented people do great things around me. I kind of took the leap of faith and said, I can also positively affect our community and our world. And so that's really what catalyzed the creation of Violet.
Amazing. I can relate to that some ways, and other ways, I think, what's the best thing I could have done for my mental health? Start a bunch of companies. But I'm really glad that you did, because this is just such a needed solution. And I'm so excited for the future of Violet and for our audiences to learn more and get involved and support however they can.
Thanks, Salome. Thank you again for having us on the platform.
Wonderful. Well, thanks so much for joining us. As always, nice talking with you, Gaurang. Have a wonderful afternoon.
Thanks. Bye.